皆さんこんにちは。北海道大学医学部学科5年の宗方です。OET スピーキングの練習第2弾としてこの動画を上げさせていただいています。前回の第1弾では北原先生の方から動画についての紹介があったと思うんですけど、今回第2弾から僕、宗方が動画についての説明をしていきたいと思います。まずはじめになんですが、前回に引き続き今現在イギリスで看護師をしていらっしゃいますロッシ真由美さんと現地のスタッフのご指導のもとスピーキングの練習を行いました。また注意事項として OET スピーキングの練習と関してはいるんですが、実際の形式と少し異なっています。実際の試験では2ケースを各5分でタスクを全てこなすというようになっていたはずですが、動画見たら分かるように今回5分優に超えてますので、そこのところ留意していただけたらなと思います。今回は糖尿病と認知症を指摘されている一人暮らしの女性が足に潰瘍ができたということでクリニックに来ました。さあどう対処しますかといったセッティングになっています。で動画の中でもいろんなところでいろんなミスをしていますので、皆さん多分お気づきになると思います。まず英語に関してなんですけど、発音にしろイントネーションにしろ文法にしろ多く間違えてますので、気になる人は気になると思います。また臨床的マネジメントの方でも、自分の勉強不足と経験不足のことから相まって長く現場で働いている先生方からはここ違うだろうと指摘される場所が多々あると思います。こういった箇所がありつつも、俺もしくは私ならこういうふうに話すのになとか、こういうふうに対応するのになとかイメージを持ちつつ動画を見ていただけたら少しはためになるのかなと思っています。また自分がしたミスについてフィードバックもたくさん受けていますので、そこのフィードバックも何かしらの役に立てればなと思っています。また最後になるんですけど、動画の編集の仕方とか内容について意見とか要望とか批判とかいろいろあると思います。下のコメント欄の方にそのところ残していただけたら幸いです。でじゃあ前工場はこのくらいにして、皆さん動画の方ご視聴ください。
Hi, I'm Yuki, who is a who is a doctor, who is working in this hospital currently. So, for confirmation, can I have your full name and the age, please?
I am Mrs. Rossi, a 78-year-old. I'm 78 years old.
Okay, right. So, how can I help you today?
Well, I have a lot of problems at the moment.
Yes.
The lady who takes care of me says I have a problem of an ulcer in my toe and leg.
And now, okay, so sure, right, and then so can you tell me more about it, please?
I didn't notice this. I didn't notice this wound. It's my carer who noticed it. I don't feel any pain. I don't feel any. I didn't know it was there. I couldn't check it.
Okay, so you said you didn't notice, but do you remember, exactly when your carer noticed that wound on your toe?
She told me about this wound yesterday when she came to examine me.
So yesterday, sure. And then you also said that was painless. So it does mean, that was not painful, right? That was not painful.
Yeah.
Okay.
It was not painful.
And then, so first and foremost, do you have any, symptoms else, or any, medical issues?
They were told I was told I have diabetes.
Diabetes, okay. Okay, so when, since when did you have that diabetes?
Oh, doctor, it's been years and years now. I can't remember. It's been long.
It's really long, so over years, right? Okay, so when you're touched on your legs, including your toe, do you feel it, or you cannot feel anything even someone touches your toes or legs?
I don't know. I was told I have decreased sensation on my toes and my fingers.
Sure. So maybe, in regards to sensation, you might have a little bit problem as well, right? So you said, you have been diagnosed as diabetes. Have you been taking medications, each day properly?
I try my best,
Yes.
but I don't know. I try my best, doctor.
Sure. And then besides ulcer on your toe, do you have anything else you have noticed?
Doctor, what is an ulcer, doctor?
Like how about
I
eye
don't know.
problem?
I don't know what an ulcer is, doctor.
Okay. Well, I think that ulcer might be complications of diabetes. And then we need blood test, detect what is going on exactly. But it might be infected a bit because you cannot have, sensations, pain there.
Doctor, I do not know what ulcer is. What are we talking about?
Ulcer is kind of, well, okay. Well, okay, so first and foremost, ulcer occurs when your nerves on your toes, in your case, are affected because of diabetes. So it's
We're
kind
talking
of
about my wound, doctor.
your wound.
Are we talking about my toe? Yes.
Yeah. Yes. And then that toe, right now, it is, visible, but that is kind of result of your nerves on your toes are affected over and over, taking a lot of times.
I understand. Thank you, doctor.
Yeah. And then, so besides thinking about the condition, maybe your diabetes might not be controlled very well and resulting in that condition on your toe. Okay.
I see.
And then, so as you know, diabetes are treated with medications. However, that ulcer might require another treatment, further treatment.
What treatment are we talking about, doctor?
Well, I think it might require a surgery operation.
Okay. What do you mean, doctor?
We cannot determine, how exactly it's gonna be like, but we might need, surgical operation, in other words, amputation of that part, infected part, because we cannot leave it as it is because it seems to be infected already. Otherwise, that infection would be spread out through your body and could end up being deadly in the worst scenario. We have to avoid it.
I understand, doctor. So can
Yeah.
you explain can you explain to me what do we need to do now? Is there anything else we can do apart from surgery? Because I love my toes, doctor.
I understand. And well, no, actually, so it requires, quite I suppose it requires, your condition requires a doctor who specializes in diabetes, I think. So first and foremost, we will make a referral to some hospital who, where there are, doctors who specialize in diabetes, and then they can treat you properly, and then maybe propose another option besides surgery. And then by that time, I'm gonna prescribe sort of medication to stop getting worse, temporary, but it doesn't mean it's gonna cure. Okay.
What medication are you talking about, doctor?
In this case, I'm gonna I will prescribe you antibiotics for a bit of time to stop that infection is gonna spread out your body. But
Okay, doctor. Mm-hmm.
But you cannot take that antibiotics, eternally, just temporarily.
I see. Will this cure the wound, doctor?
Well, that antibiotics does not cure your wound. Just stop it getting worse. And in order to cure that wound as well, it requires further treatment. And then a doctor you're gonna see is gonna show you in proper medication or another options.
All right. Okay, doctor. So that answers my wound. Thank you very much.
Yes. So anything else you're concerned about?
I'm not sure what my carer has told the nurses, doctor, and in your practice, but I have. They told I have a lot of problem.
So like what?
I'm not very sure, doctor, but I think they told most of my problems already. I think I'm fine, but I think I'm fine. I don't see any problems, you see, but then they told me I have a lot.
Okay,
Have they
then
told you anything?
I think diabetes can contribute to a lot of complications besides ulceration or ulcer on your toes. It can affect your kidney, eyes, or other parts. So we've already decided to send you at a hospital who is going to specialize in diabetes. But I can say you might be examined more rigorously throughout your body to detect any abnormalities or any issues.
Okay. Sorry, do you want us to continue, Mayumi, or
Yeah,
that,
so can I pause? Okay. So now it's just you're already talking about what the patient explained, but the patient have a dementia. Okay.
Okay, so I couldn't know
So
that.
Patients can't understand what the situation is.
Yeah.
So maybe ask a
Well,
question to the carer.
To be honest, I thought there was a carer besides her, but
Yeah.
I could only see
I see.
patient.
Yeah.
So
Okay.
Yeah.
So maybe I'm going to talk to you as a carer. So now, Kabi and Francis, do you want to switch?
I can be the carer as well if you like. You know,
Yes,
like. Okay.
Perfect.
Go ahead.
Okay.
So now you talk with the carer.
Yeah.
Hi.
Yeah. Okay.
Okay, so
hi, Dr.
Hi.
Yuki. I'm the
yeah,
carer
bro.
of Mrs. Rossi.
Mhm.
Okay. I'm the carer of Mrs. Rossi, and I've told she is quite in a difficult social. She has quite difficult social circumstances at the moment because she lives alone.
Yes.
Her husband passed away 3 years ago, and I think she's being forgetful.
Yeah.
And she's being forgetful. She didn't notice that she has a wound. Her eye, I think, is really bad, and she's walking with a stick.
Yeah, I totally understand. And then, so I've already done, some examination of her. So there are several things we have to discuss. Okay, and then first, let me explain to you what is going on in her. So first and foremost, her ulceration comes down to her diabetes, which might be uncontrolled. And then that seems already be infected, unfortunately. And then we cannot leave it as it is. Otherwise, it could spread out her body entirely, and then it could cause her death in the worst case.
I see.
So it means she needs operation, we suppose. And then also up for her dementia, thinking about her age, we cannot say exactly what causes her dementia. But diabetes could cause dementia named vascular dementia. However, it might also be Alzheimer or other types dementia. So in order to detect what it is exactly, she might also need, we suggest she goes for neurologist.
Okay.
And then most importantly, not only her toes, but also her eyes and her kidneys might be affected as a complication of diabetes. So she need go under the examination about those parts. So we think she needs a further treatment and care, which is done by specialists for diabetes. So we have decided to send her at a hospital, which has a specialist team which focuses on diabetes. Okay.
All right, I understand, doctor.
And then other thing we have to discuss about, unfortunately, diabetes is kind of condition requires a lifelong care and treatment. And then you said she has living alone currently. However, she needs proper medication intake day by day, as well as a proper rehabilitation to maintain her best condition. But because she has dementia, we cannot guarantee she can do it on her own. So we suggest it might be better for her to start living in a kind of nursing care home.
All right, doctor, I understand. I agree with you that it's not safe to be living alone.
Yes.
So how do we go forward from here, doctor?
So, well, we suppose the hospital which we're going to send her can provide, further option even about post-hospital care, like including nursing care home and as well as other things. However, if they will not provide any options, please get to us so we can show further options. But at least at this moment, she needs to go to the hospital and then treat her complications as well as her diabetes itself.
Okay, I understand, doctor. Well, Yuki, you did very well. All right.
Yeah.
I just wanted to ask a few questions first before I give a feedback. Is that okay?
Yeah, okay, fine.
You're practicing this for OET, is that correct?
Yes.
That's for OET, okay. Right. Now, I saw the structure of OET grading. Mayumi, I did my homework. Are you familiar with the structure of the grading for OET speaking test?
Well, to be honest, I'm not familiar. I'm not familiar with it very well.
That is fine. Yeah, you have a lot of time, and you said you have 1 year of medical school more, so that's fine. Okay. So I would suggest that before, when you take the exam, you check the grading system, because so that you know what to work on. All right.
Yes.
In a regular clinical setting, what you did is fine. It's good. Okay. Because you have time. You have like 30 minutes to talk to me, and it's fine. But in the exam, you have 5 minutes. So imagine doing all of that in 5 minutes.
So you mean a quick, short, sharp?
Yeah. So you need to be short, concise, exacting, but at the same time, tick all the boxes for the grading. You know, which is I understand very difficult, because you're working 2 things. Number 1, your medical knowledge, okay, which is good, and then the second, the language skills, okay, and you speak good English, okay. But in the context of OET, I think you need to practice meeting the objectives, okay, because 5 minutes, Yuki, 5 minutes. That's a lot. That's quite short, yeah. Now, it's good that when you talk to me as a patient, you introduce yourself. That's always a good start of building a relationship, and it's appropriate start for building a relationship with the patient. Hi, I'm Dr. Yuki. I'm one of the doctors in this department. The introduction was good, and you were very attentive to the patient. So you feedback to the patient by saying, "I understand." When you say, when I say something and then you say, "I understand," which is really good, because how do I put this? It's a really strong phrase. When you say to a patient, "I understand," that's very strong. It's really a strong way of building empathy and relationship. Now, I'll be giving you a feedback in the context of an OET. Is that okay? Or would you like me to feedback in the context of general history taking, or what? You tell me, Yuki. What would you like?
Yeah, just whatever feedback. I'm gonna, I love to listen to it.
Okay. All right then. So in the OET structure, I checked. there are five, so there are 2 points, the language skills and the medical skill, yeah? And then you have to mix them to reach 5 goals, all right?
Mhm.
So the first goal is relationship building,
Yes.
which you did with hi, how are you? I'm Dr. Gant like this, and can I have your name, please? You know, and stuff like that. And then second is patient perspective.
Second, yeah.
Okay, so you did all the patient perspective questions except for one important aspect by asking, what do you think is causing this?
Yeah.
Yeah. So if I because you were asking, did you see I mean, you have to ask if the patient understands what you're experiencing. So do you know what's the problem? My carer said I have a toe, and then you ask what's the cause, and then I said I don't know, and then you explain diabetes. So which is very straight. I mean, you have to do you understand what's the relationship of your previous conditions and what you're experiencing. So it's always nice to ask, like, do you understand? Do you understand? And that's fun, okay? But you did well with asking all the questions. Did you hit it about the ulcer? Okay. And so it says here that patient perspective, you have to be attentive, non-judgmental, and empathetic. And saying I understand is empathy, so which is good. Like, oh, it must be. You can also add words such as, oh, it must be very difficult,
Yeah.
or something like that. It must be a hard time. It's like, oh, I don't know. If I said I don't know, I'm taking my medicines. You say, so you ask the patient perspective by saying, who gives your medicines? Do you take it alone? Is your carer helping? And stuff like that. Okay.
Yeah.
Then another good good part of you said is when you broke down the causes of dementia. That's a really good way of explaining something that you that has multiple causes. So you say there are several causes of dementia, and you don't know how much of the diabetes is causing it. So, and that's very good. And then you suggested a referral, which is good. Okay. So management-wise, you're okay there. The language skills is fine there as well. Now, the management of the ulcer, Yuki, it's only 2 to 3 centimeters. So it's quite small.
Okay. Yeah.
Oh, sorry,
Indeed.
grade 2 to 3. So yeah, it's one big toe and leg. Okay, so well, this is not your fault because you don't know how big it is. Okay, but it would be good to have a stepwise manner because if you look back, you suggested surgery immediately. When if you want to build a good relationship with your patient, you start with the small ones. You don't because you don't want to scare them. They might get
Yeah.
scared of surgery. So you want to say, oh, maybe we can clean it first, and then we can try antibiotics. And then if that does not go well, let's decide what to do after, which can include surgery. But let's try the first ones first. And that's a chance for you as well to show empathy to the patient because it's scary to have surgery and you will agree with that. But also, it's a chance for you to display good language skills there by, using a lot of vocabulary like I don't know, like we start with cleaning the wound, removing the dead, the infected tissue and stuff. So you're using all those. You can use a lot of words we can show in your language skills. Because remember, OET is still a language skill anyway, right? So you have to take that chance to display as much as words and vocabulary, how rich your vocabulary is. Speaking of vocabulary, when a patient asks, "Oh, I don't know what an ulcer is," for example, you use easier words such as wounds, the skin break or something like that. Because not everyone understands medical terms. Yeah. So
Yes.
that's your chance as well to show a rich vocabulary. Don't be scared to use non-medical terms. When I was practicing in the Philippines, I always thought, oh, I have to use the medical terms, so like the diabetes and the ulcers and cataract and all that stuff. But don't be scared to use ordinary terms such as uncontrolled blood sugars in the blood, sugar levels in the blood, for diabetes, because it's something that they understand. Wound in your toe and in your leg for ulcer or something. Debridement for, you can say, cleaning the wound, removing the dead material, the infected material. So you take that chance to use other terms to discuss the disease. Okay.
Yeah.
And also, it's really good that you've suggested referrals, because that is good practice. You don't have to do everything yourself. It's to ask help or to give the case to a place where it's not your territory anymore. Then that's a good practice. I can imagine, Yuki, it must be very difficult to do the test because you're practicing your clinical skills, your medical side, and also the language side. But do not forget, okay, that the language as well is being tested here. So you take the chance to display how rich your vocabulary is.
Yes.
And at the same time, not sacrificing the management, okay?
Right.
So overall, it's good. You asked the necessary questions. You explained the necessary management, which is the goal of the scenario. Yeah, that's it. You just have to identify where you can, at the points where you can improve, Yuki. Okay.
Okay.
Thank you.
Many thanks for your constructive and help advice. I really
No
admire
problem
it.
at all. No problem at all.
It's a good thing is the France is very, very good and how to explain for the patient normally.
Yeah.
That's a compliment, Francis. So sometimes if you just explain to the patient, dementia patients or non-clinical staff, if you sometimes using too much medical terms, they really not clue. Sometimes there's the insulins. Okay, what type of length is the insulin? How the insulin works? What does diabetes mean? That's a simple term, but it's not really clear. Okay, and if it's picky feedback, all the time in this country, informed consent is essential.
Oh yeah.
And consent. Any treatment, any testing, we have to need really clear explain to all the patients.
Yes.
Okay? Even dementia patients, you have to need aware that the Great Britain through legal term. Okay, we have a lot of Mental Capacity Act, so we have to know that it's a lot of safeguarding. It's going to be not really available in Japan.
Yep.
So, and also this grade. I already set up grade 1 and 2, but we have in England using the grade 1 to 5. I'm not sure for the nowadays in Japan, how does you grade it for the ulcer? Okay.
Yeah.
It's just gonna be, it's American, the systems, Japanese system, English system, it's completely different.
Yeah.
It's like a new observation, we just do it for Glasgow Coma scales. Okay, but it depends with the Sansan Kudo scale. Okay. there's some hospitals do the Grascom scales, but there's other hospitals Sansan-Kudal scales. So that's just to make more confusions. But if you just come to the England, of course, using for English systems.
Yeah.
Otherwise, when the OET test, it might be they're not clear what you're talking about. Okay.
Yeah.
And sometimes when I explain to patient, there's this start using easy word. If it is diabetic patient, yes, if you're not really treating quite well, infected really badly for the wounds, end up amputation. Don't jump in the conclusion.
I'll run away. I'll run away if you said surgery in the first instance. You know, I'll be so scared.
Otherwise, I mean, amputation. Oh my God! I don't want to do the amputate my leg. So starting, okay. So just what we need to do, we're going to ask nurses to come in to change your dressing every day. And also, they're going to start the antibiotics, treat your infection first, and then we just need to control also at the same time your diabetes.
Sure.
By step, don't jumping up to eventually that's amputation. That's everyone's about amputation. Start amputations only to think about it. That's going to be starting. Oh my God, is that much serious? So that is
Yuki.
Yeah.
Don't be scared. Don't be scared to undermanage.
Yes.
Like to manage the patient. A step down.
Yeah.
Because it leads to the patient. It leads. How do I put this? So a good way, for example, is like
it's more
you ask them, would you sorry, yeah, Mayumi?
What's the more priority treatments?
Yeah, so what you have to ask me as well what I like to do, because like I said, I like my toes,
Nando doesn't want losing a toe finger.
Of course, yeah.
So don't be scared to show the lower management first.
Yeah.
So you say, this is something we can try, we can try this. If it does not work, we can try this, and then go to management. The difference, I think in the Philippines as well, the Philippines, the doctor is in control. Okay, so if the doctor says, let's do this, it's done. What I felt what is being different here is it's a partnership. So you ask what the patient likes to do. Okay, you ask the patient what he understands. So if I would have seen an ulcer and then I will suggest a treatment, I would say, do you understand? Do you know how this ulcer is being treated? And if I say, oh, I have a cousin who said I just put cream and that's fine. And that's a good way of building relationships. So do you know how it's treated? And then I say something and they say, oh yeah, that is correct. Creams work. We can also clean it. We can, if that does not work, we can have this one, amputate, but so that you know where to go in. So if I say, do you know how it is being treated? And I was like, oh, doctor, I'm very scared because my cousin said it's amputation. And then you'd say, yes, that is correct, but there are other things you can try. It's because you want the patient to be the partner in the treatment. Yes, I don't know in Japan, but in the Philippines, it's a bit of one way. You say, you give this, you take these medicines, you take these medicines, I'll do this, and then I'll amputate if it doesn't work. Here, what is different is they ask what they know, and then they ask what they want to be done.
Yeah.
If the patient says, I want to keep my toes, I want to watch it die, I want to watch it rot, I want it, then that's their wish. Our job as a doctor is to say, okay, let's prevent, let's prevent it from making it worse and stuff like that.
Yes.
So don't forget to ask. I think generally, Yuki, you're fine. Okay, you're fine. You're okay. You need to practice to perfect it. But one thing that is lacking is getting the patient's perspective. Okay,
sure.
So
I'm gonna be more careful about it. Yes.
Yeah. So you can always ask, do you understand what is causing this? What do you want to be done? Something like that. Okay. but otherwise you're okay. You can perfect and practice it. Okay.
So then when you practice, you just need to be actual test of 5 minutes.
Yeah, and then the 5 minutes, which is
It's really challenge. Okay, so it's
that
just
is really challenging.
it's pretty clear
Yes.
and etc. etc. So that's gonna be that it's gonna be more. You have to need a clear mind of what you're talking about in the 5 minutes. It might not finish during 5 minutes. You can explain, but it just need to be if you just clear the point.
Yeah.
Okay.
You see, Yuki, this is similar to the step 2 of the licensure exam here in the UK.
Wow.
All right. So in the step 2, they also so this is not OET anymore, okay? I don't know if you've heard.
Yeah.
Have you heard of the PLAB?
Yeah.
Yeah. So the step 2 of the PLAB, they also examine the words you use and how you relate to the patient. And it's 8 minutes. So you have to take the history. You have to, yes, what you mean. You have to take the history. You have to manage the patient and everything like that within 8 minutes. So you'll go straight. What I did with that is I read the case and I go straight to the patient and say, hi, good morning. I'm Dr. Cruzes and I'm one of the doctors here in the case is GP. So I'm one of the GP in this practice. How can I help you today? I say, can I have your name, please? You go straight. So can I just have your name, please? I'm Yuki. So hi, Yuki. How can I help you today? If the patient doesn't say anything, like what I did, I said, I don't know what's my problem because I have dementia, right? You can go back to the case. You saw the case already. I have dementia 1. Well, I was told that you have an ulcer, and then that saves you so much time. I was told you have an ulcer. You have some memory problems instead of dementia. You say memory problems, and that you live alone and like that. So don't forget to look at the case. That's it.
Okay.
Yeah.
So how many cases you have to go through, during the step 2? I mean, prep step 2.
Oh wow! Now it's over 100 cases. Yeah.
Wow.
But because the chief complaint is always the same. So for example, the chief complaint is a breast lump.
Yep.
Okay? A breast mass. You can have 5 cases of that. You can have a benign breast mass in a 16-year-old. You can have a malignant breast mass in a 50-year-old. You can have you're unsure of or anything. It could be a breast mass and you're the GP, or you're a breast mass and you're the you're the surgeon. So breast mass, but same different patients. So that's why it's a lot. But think about it next time, Yuki. Think about it next time. Like I told you, what you need, you're in the right direction. You ask the right questions, but work also on patient involvement by asking, what do you know about this? How do you understand about this? And what do you want to do about it? Okay.
Okay. I'm gonna ask about it. Yeah, I'm gonna ask about these questions, paying attention to time as well. Yeah. I do it.
I would say, because you would, if you have 5 minutes, you would say, hi, I'm Dr. Cruzes. I'm one of the doctors in this GP practice. How can I have your name, please? And then the patient name. And can I know who we are with? Then the carer. And then say, how can I help you today? And then you say like this, like this, like this. And if they don't say anything else, tell what you know. So you say, oh, I went to your records and I was told that you have memory problems. So take control of it because the time.
Okay.
Yeah. Okay.
Yeah, that's good tip. Yes, thank you.
Thank you very much, Francis.
No problem.